So let me just briefly introduce myself, and then we'll get on with the session. But what we're going to be doing today is a very fast-paced activity broken into sort of 3 or 4 10-minute sessions of about 35, 40 minutes of actual team time. And I'll do a short introduction. It takes about 10-15 minutes to set the stage up for this. So I'll give you a short introduction to myself. My name's Bill Evans, and I myself am a medical product designer, now 30 years in the device industry, and working now substantially across both digital health products as well as physical products. And often those two are joined together nowadays, particularly in things like the pharma world, to some extent in certain chronic disease management and so on. So this is a very appropriate, timely workshop about joining of these two things together. I'll say just a short amount about Zymedica, and then I'll shut up about them. But Zymedica is now a 300-person strong venture-backed capital company that focuses on the design and development and commercialization of medical products, both physical and virtual products, where we have a range of skills from very front-end research and designers, all the way through the different engineering disciplines, all the way through to regulatory and pilot production. And by example of a connected product, which is very relevant to today's discussion, here's an example of a project we did, and I'm showing it really because it's a good example of some of the things we might be talking about today. And it's a simple add-on cap that we developed for a company that was a spin-off out of MIT. And they took the very common, multi-dose inhaler, many of you will know from asthma, and they said, wouldn't it be great if we could have a device that helps with compliance, adherence, managing, say, parents managing a child, a loved one managing another loved one, a doctor worried about a patient not being compliant. And for a relatively low-cost product, it can be added onto any multi-dose inhaler, and it records when you've pressed it. When it gets near a phone that it recognizes, it downloads that data, uploads it to the cloud, so it's available to caregivers and or doctors or drug manufacturers and so on. And it's got a little flashing light in it that when it's time to take that dose, it tells you that it's time to take it. So it's a really good example of something. I'm not suggesting you copy this in your ideas when we talk about the particular medical condition, but it's a good example of something that's actually reduced to practice. And in fact, this company was acquired, I think they started about 3 years ago. They were bought by Teva about a year ago, so they're now part of Teva's offering. So it's a good example of how the big companies are interested in the innovations coming out of small companies like you guys today. And now my colleague, Matt Loftus, will be here. We started a little early, so he'll come. Don't worry, no worries, so we're fine. He'll come and help. And really, today, just in terms of what we're talking about today, is we're going to use an example of treating eczema, a drug that treats eczema. And we've chosen that particular example because I think most people here know what eczema is. They probably either had it themselves or had a family member who's had it. And it has lots of qualities to it that make it very ripe for a connected health or ecosystem type of product. So that's the example we're going to use, and I'll go into more detail in the next few minutes. So, and obviously the big thing that Connected Health's great hope is, which is being discussed substantially here today, it's about shifting the engagement from being just episodic, occasional visits, to being, of course, something that can better integrate in your life, and that's obviously the thrust of today. And the other thing that we find that's very important is that it's understanding your users and really understanding your various stakeholders that help you identify where the business opportunities are in building an ecosystem around your product. And it might be a drug, which is the thing we're going to be talking about today. It's an ointment, if you like, but it could be a device. And quite often companies can extend their value to their customers by building an ecosystem around it and not necessarily developing a new device per se. So it can sometimes be a very cost-effective way. And I think the one thing that I would notice from the companies we've worked with over the years is that companies will often come in with a sort of a somewhat single-track vision of what they want to do. They'll say, we've got this technology for adherence, or we've got this technology for therapy, and they sometimes don't step to one side and look at who all the stakeholders might be that could benefit from it. And I think one of the things we want to encourage you to do today is to open up your thinking about who could be brought into the fold of benefiting from an ecosystem that you might build around a product. So that's one of the ideas today, that's the important thing. And of course, it's about adding value, and that's a very much used word. And in fact, if you're interested in value, I noticed, I don't know how many of you have seen, but AdvaMed have just launched a big value initiative. Has anyone seen that? It's pretty amazing. Deloitte's written a bunch of papers on how medical companies can evaluate value, and I strongly recommend it's on their website to download and so on. So value, it's all about understanding what's valuable to whom, when, where, and how. And if you think about it, it used to be a year ago you'd walk around at conferences like this saying, who needs another app? And that was an example of people saying, well, we don't need another app for that, we need to integrate with, say, an EHR in a hospital. Now, fortunately, the goalposts have moved on. People don't talk about that anymore because they now recognize that you go to where the information is currently being looked at and make it more accessible in that location. So it's all about understanding where it might be valuable to people, and that's what we'll do in this exercise. Who are the people it's valuable to, and understanding those touch points in that. So what we're going to do today is these 4 steps over a relatively fast-paced session here. And the first step is a loose concept generation session where you'll work individually or in pairs on the table. So what I have is I have some cheat sheets to help you, and I'll get those out in a second, I'll explain them, where you come up with ideas with just one of you or 2 of you, you come up with ideas in that first 10-minute session. Then we move to a second 10-minute session where within your team of 6 or however on the table, you share those ideas, and I will go over these before we begin each session again. So you share the ideas and you maybe put together, synthesize several of the ideas into 1 or 2 ideas, so that you're not yet choosing which is your favorite idea, but you're adding pluses in and saying, oh, that was a good idea from there, let's add that to this feature, to this product idea. And then the penultimate step is to home in as a team of 6 of you on what you consider to be your product solution you're going to pitch. So you're going to say, okay, now this is our idea, give it a name, think of some fun name, light-hearted name, whatever relates to some feature of the product. A bit like Care Tracks was a name. Obviously, it's about tracking your care of asthma. And then you're just going to do a 1 or 2 minute pitch. I want you to nominate someone on your table to do a pitch to the other players, and we'll have judges. Someone on the tables will be judges, and we'll decide who we're going to give the investment of however many $1 million to that. So I hope we get that idea. So let's move on, and I'll show you the tool that we're going to be using. Did I? Yeah, so I told you we're going to be using Eczema, and I'll show you the tool, and then I'll give you a little briefing on Eczema. And the tool we have, which we're going to give out quite a few sheets on the table, is if you put like maybe 6 on each table. And what it is you can see on this drawing here, let me see if I've got a better one here. It's a system mapping tool, and what it uses simple icons to describe different elements that might be in an ecosystem. So if you look at it, and then there's a second sheet as well, Jill, thank you very much. The second sheet is there's a cheat sheet that tells you the nomenclature. Here we are. You can have a few. This is the one that allows you to see the different things. And what it does is it shows you, and I've got an example for Care Tracks, but it shows you this, like you've got, obviously the center is the patient, we're putting the patient in the center. You have a caregiver, potentially, or some other stakeholder that's not a medical professional. You have things like the providers, the payers being the insurers. You have a place where there's monitoring devices, and you can make up monitoring devices for this, even if a monitoring device doesn't exist. I just blogged about Alexa on our website, joking that Alexa brought out this new smart camera, and my blog is Alexa, do I look fat in this? And then I went on to say maybe Alexa will move to Alexa, can you help me look less fat? So it's sort of like, it's interesting. There's a huge amount of interest in AI at the moment amongst the pharma companies in helping. So think about imaginative things. So there's informatics processing, therapeutic devices, fulfillment. ResMed, which is one of the leaders in ecosystems that surround it, had a slide yesterday. We did a tour to ResMed, and the CEO of ResMed got up in front of a chart that used almost exactly these kinds of symbols and these kinds of relationships to show the link in their ecosystem. And one of the big things in ResMed is that they are really, through their company they acquired, Brightree, they are really focusing on helping the supply chain better manage the patients and the equipment the patients get. So don't think outside the box. It's not just about the therapy's impact on the patient, it's about how you can smooth the supply and all these sorts of different things. And I encourage you to go look at the ResMed website if you haven't, and I'm sure that's available. They told me it was on an investor presentation. So this is the example of the thing, and I suggest you're going to work individually with this, or two of you just chatting, coming up with ideas like, I can add this, we can have this relationship, we can streamline the distribution here, we can come up with a drug delivery device there. These are the sorts of things you're going to sketch on here. And I encourage you to be scrappy with these. It doesn't matter how you do it. I've got a bunch of pens. Jill, if you wouldn't mind. A bunch of different pens, different colors, just so big. They're bigger pens, so they're easier to read. Because when you come up with your favorite idea for your team, you're going to put it all onto one big sheet at the end that you can do neatly. So it doesn't matter. Think of these as working documents. Okay? And what I'm going to do now is give you a very rapid-fire 5-minute overview of eczema so you understand who the stakeholders are as you do this hypothetical exercise around what kind of ecosystem you could surround the treatment of eczema with. And I have more cheat sheets, which is that these research reports are, put a couple on each, are this slideshow I'm going to show you now. So if you need to look at it during your brainstorming sessions, please feel free to do that, and feel free to ask me questions as well. But again, just to give you a lightning overview of this, and I'm not particularly an expert in eczema, but I have worked a lot with chronic disease. And really the issue with eczema, which makes it a great example for this, is that the issue with the topic, it's a topical drug that you apply, so that's the drug that's the hypothesis, some sort of cream or ointment. And the issue is that it's got to be applied regularly, 3 times a day, and that, like many drugs for chronic disease, it will only be effective if you use it regularly. And the other thing that's common in chronic disease as well is that quite often people stop using the drug when the symptoms go away, and that's often the worst thing you can do to manage your disease. So another quality of this drug is that, that if you don't keep using it regularly, even after the condition goes away, it's likely to return. So there are all sorts of complications, if you like, that will arise from this that may make you have to escalate to a more expensive drug. It may cause you sleepless nights. There's all kinds of inconveniences with not simply using a drug regularly and consistently, even if the symptoms aren't showing. So there's obviously lots of business opportunities that come up from this. It's for the patient, it's, they're obviously going to regain some of their lifestyle, maybe get their sleep back if it's irritating them. For the drug manufacturer, of course, it's about influencing the sales of the drug. If someone's regularly taking it, you're obviously going to improve the number of units that you shift. From the pharmacy's point of view, and remember these people are very important in the management of drug distribution nowadays, and that's why I believe Amazon, for instance, is just searching about going into the pharmacy business. You create more loyal customers, and from the doctor's point of view is the possibility of managing both an individual patient as well as a population of patients. A given GP might have 100 people with eczema in their practice that they might be trying to monitor, improve, and it also might partly be to avoid moving to a more expensive drug, say, for instance. So it's about cost savings as well. So you start thinking about the stakeholders. You've obviously got the lay users, the patient themselves. We've talked about this. You've got potentially caregivers. It might be a parent, it might be a loved one who also has a stake in helping that person manage that disease. And obviously, anything that we can do, there's innovation opportunities listed here, anything you can do to maximize that consistent use, encourage that use, anything that you can do to surround, you know, the sort of socializing of the thing. Can you help other people, friends, family, be part of motivating that treatment? It's a bit like that annoying friend on Facebook that says they want help giving up smoking and they've got to ding you every day or something like that. But those sort of things obviously clearly work as well. So then you've got other stakeholders would be the direct care clinicians, where you've got obviously the doctor in charge who's interested in this. They don't necessarily have a clue how the patient's being compliant. At the moment, without any method of knowing what's happening out at a patient's home, they may not know for 3 or 6 months that it's not working well. And so anything that they can do to help understand and monitor that. If we look at some other stakeholders, I've talked about the pharmacy and drug companies. They've got interests in this. People don't pick up their refills. Could they do more to support the patient's care? Could they increase the loyalty to their specific drug because they support it better for the treatment and therefore have happier customers? You get the idea there. And of course, from the insurer's point of view, again, it's can they both Can they drive the compliance, as they would put it, and I would put it more in adherence? Can they help people become better at regularly using it? It may stop them escalating to maybe an ER visit or to a more expensive form of care. So there's lots of motivations amongst different stakeholders. And this would be the typical output of a research program that you might do to analyze that. And we would encourage, it's surprising, as I said, how many companies come to us who have not broadened out their view of the stakeholders. And I encourage you to think widely of these as we're moving on. And then last point here, before I let you rip on actually doing it, is to think about the context of use. And again, I don't need to go into these in details, but remember there are many different places where you might need to use this drug. And so therefore bear in mind those different things. So for instance, with care tracks, the beauty of this is that it's robust enough and so on to throw this in a kid's backpack, for example. And the context of use for this, it might be that the kid does not have a smartphone. You know, nowadays I know the average high schooler with, but a middle schooler may not. Yet it's still a useful product to that because they've thought through the context of how it gets supported by a parent, for instance, as an example of that. Okay, so I think I've dwelled enough on this and just give you a quick example of this just to show you the kind of simple overview level that's necessary to capture it on these charts. So I put the concept name at the top, care tracks, and obviously you circled the patient, and then the ecosystem that I would think about is I'm going to say, okay, I'm going to have a sensor on the device that reports to the smartphone what's going on. That smartphone gives feedback to the user, and the user gives feedback to the smartphone, you know, if they're having improvements in symptoms and so on. That then sends it to the cloud, and that then enables analytics, which is what that box is pointing at there, to analyze the data, help present that data, send it back to the smartphone with more smarts added to it. Then maybe they've applied AI or something to helping, maybe they've applied gamification, whatever that's necessary there. And then it then gives feedback to the user. It then gives feedback, of course, to the providers, the doctors, the pharmaceutical, the other clinicians that get involved and so on, such that they can then get that data, interact with it both on a population level and on an individual layer, and also the insurers like it, as I described before. So I think you get the idea, and in this case, of course, it sends something to a caregiver if there's a caregiver involved with a child or something. So I think you get the idea of how simply, these charts enable you to more simply lay out the plan as you're thinking. And then the last point, which we'll do towards the end of this 10-minute session, is to score your concept by these 3 factors that are in the lower right-hand corner. And those factors are simply the complexity of the system, the value of the system to the stakeholders, and that's, you could think of that as a benefit both to cost, to outcomes, anything that you care to add a high value to, that your stakeholders would add value to. And then the cost of goods. And we score, the care track scores, it's pretty medium complexity, it's not a very complex device. It's fairly high value because it drives a lot of these things we've talked about, and it's actually pretty low cost to make and distribute. So that's how that would get, Jill. Yeah, yes, actually you can use poetic license. You can say, I'm going to make it a spray, I'm going to make it a cream, I'm going to make it a patch. But bear in mind, it's eczema, so it has to go onto the whole surface. So you can't cheat by having it be a wonder drug that you just swallow. But I mean, feel free, I'll walk around in the sessions. I'm not going to stand here and talk for 10 minutes in between. So what I'm going to do now is we've divided this up into 10-minute sessions. So this first one, to remind you, is work individually or in pairs, come up with ideas, discuss them yourselves, sketch them out, change them around, and at the end of 10 minutes, we'll go for it. And I have, let me get my, I've got a timer as well, so I'll get that's in my bag here.
This is the incentive.
Okay? Okay? Are you guys ready?
Yes.
Yes, okay? So, yes, just think of some, light-hearted name. You nearly ready? Yeah, great. Okay, so who wants to go first? Somebody want to flip a coin? Do you want to go first? It looks like you're ready, so. Yeah. So who's pitching from here? Okay. All right, so who's pitching? So if you would come up on stage, because we're gonna video it, because it's good to, and bring your chart, Yep. Do come up, please. And you just hold the mic fairly close and it'll go. So this is team A, okay? So this is pitch A. I'll let you do the introduction and everything, okay? I'll hold it for you. I'll hold the chart for you if necessary.
Okay.
So if you take the paper, and then if you just mind hold that fairly close to your mouth. I'll be the...
Our product is named Eczema, EXITA, and the form factor of this product is a roll-on device that you can apply your medicine on your skin. And this roll-on device, joint here, has a dosing capability, because when you need to apply, you need to you need to turn the dial so that thing can give measurement how much is being used. And this device also comes with a Bluetooth sensor, so whenever the patient use the medication, you will send signal back to patient's smartphone. So the data will come from whenever the patient uses this Eczema, will send signal to the smartphone, which will collect all the data into the cloud, and the data will send to physician to report how much is being used, and the pharmacy when the medication is low and need to be refilled. And at the end, and also the data can also send to like a care team. For example, if you have young children, then the kindergarten teacher can also be notified if they have the app. And also the data in your smartphone will keep record how much is being used. If it's not being used frequent enough, they will send notification back to the patients to remind the patient to apply the medication. And the notification will also send to the physician. And I think
those are the main points. And so the one thing I'd ask you to do while the other people are pitching is I forgot to mention there's this three chart at the bottom. So if you could just score your idea according to that, just you can do it while the others are pitching as well, okay? Thank you very much indeed. Okay. It's called Exit
here.
Exit A, right, Exit. Got it, right. And if you could just write that on the top. Okay, team number B. Team B, thank you very much for doing that. Thank you. Team B at this, there's a lot of money at stake here, $6 million. I'll be your, I'll hold you. Have you got your chart? Have you got your chart? And again, I don't know if you thought about the score at the bottom. Maybe you can do that. All right. Let me, here, hold this fairly close when you're talking so it'll mic up correctly.
Hello.
Okay.
Can you all hear me?
Go.
So we are Itching to Heal, and we're an eczema compliance system, right? So what we do is basically we have this multi-pronged approach to helping the user basically become addicted to complying with our eczema treatment, right? So basically what our value proposition is a delivery system, right? Where, all right, I should have rehearsed this a lot more.
You're doing great, don't worry.
So the way this works is that what's in the box is a base, which is sort of a charging station for a spray, right? Spray is the main delivery system, and what this does is the spray bottle records, every time the user uses it, and they put it in the charging station, and the charging station sends all the data to the user's phone, right? And if they don't, if they forget to use it, right, or they don't keep using the system, they're going to get a notification, right, that reminds them, use use the system, right? So go back, use it. If not, we're going to send yeah, like we're going to send a message to your health provider or to your doctor, just telling you, you haven't used this. So it's basically a way to increase communication with the provider. What else? Right. So there's a couple other things that we're doing. One of them is symptom reporting. Right. So we have this a smartphone app that collects all the analytics. What it also does is it sends the user surveys, right? So the user gets surveys to their smartphone, and what that survey does is it asks the user about their signs and symptoms, and it also asks the user about different triggers, right? So when and where the eczema was triggered, and by collecting that data, right, the healthcare provider can get more and more accurate, a more and more accurate picture of what the user's doing, when they're getting triggered, right, and how they're actually complying with the system, right? So the whole idea is to create this kind of like a feed-forward feedback system, right, where there's a whole bunch of information going to the healthcare provider, a whole bunch of information coming back to the user, right, from the healthcare provider, and also from the delivery system and sensor systems as well, right? So one of the big things that we're focusing on is that we're trying to sort of phase in more and more sophisticated ways of actually measuring triggers, right, and triggering conditions, right? So we know that one of the biggest triggers for eczema is stress, and one of the a surefire way of measuring stress and of physiologically actually seeing it is through skin temperature, sweating, the kind of stuff that an optical sensor can pick up really well, right? So we had the idea of connecting this app system, right, to an optical sensor like the kind you would find in what do you call it, like an Apple Watch,
Smartwatch,
right, like a smartwatch, right? So, and the idea is to kind of like have this software hardware ecosystem, right, where we can just increase the variety of ways that we're picking up information about when and where the user gets triggered. Potentially in the future, right, we could actually have even a cloud database, right, that just covers all these data points, not just of compliance, but also covariates of triggers, like when eczema gets triggered, under what conditions, are there any significant associations between triggers? Are there any kinds of associations between symptoms and the triggers themselves? So, the bigger the data,
okay,
right, the more.
Yeah. Okay. Well, I think I'm going to in the interest of time. Yeah. So thank you both teams very much indeed. I suppose the judges should get together. So that was great, and I think that what it shows is that although there were a lot of similarities, I think you guys did a great job at broadening out. Oops, sorry about that. You guys did a great job at broadening out between all the various stakeholders. And as you can see, some of these pitches really would sit. It wouldn't be surprising to hear the kernel of this idea at a pitch fest or something where you actually have real startups talking about this, because a lot of the things that you guys touched on around delivery devices, around monitoring, around analytics, these are very much now the stock in trade of this stuff. So thank you very much. So the judges' point of view, we had 3 judges. So we're going to decide how to award the awards here. So I think in the interest of being equitable, I think we're going to award $3 million to each of the companies. So feel free to spend it just to be totally chicken here. And say, you know, as I said, thank you very much indeed for participating in this. I hope you got something out of it. It was only an hour, but really, you know, you guys, I listened to the dialogue, and I think the brainstorming part I see was suitably light-hearted as well, which tends to work as well to get good ideas out there. And you can imagine that if you did that around an ecosystem you were trying to build and actually put serious resources into the research, serious resources into the concept generation and so on, you could quite see that really, you know, and you'd be surprised how often companies come to us who have not really thought through to broaden out, and by broadening out, you can see lots of advantages. And obviously another thing that's happening is a lot of partnering. So you saw a lot of companies here today that have certain pieces of the pie where they've got very good analytics or something, and you can start adding those kinds of things in. Anyway, I hope you got something good out of it. Thank you very much for participating. I think we only ran very slightly over an hour, so thanks a lot.
I actually think the more you do,